Hi, Paul Sackis, Good News Broadcast, speaking to Dr. Bradley Knight. Hi, doctor. How are you?
Great. How are you?
Okay, good. Cardiologist, specialist with heart rhythm disorders. And you're at the, well, I just had it here. Whoa.
In Chicago at Northwestern.
Northwestern. Okay, perfect. All righty. And we're going to talk today about teaming to help Americans with atrial fibrillation, okay? Atrial, A-T-R-I-A-L, maybe I can spell it better than I can say it, Fibrillation, F-I-B-R-I-L-L-A-T-I-O-N, which means?
Well, atrial fibrillation means it's a heart rhythm disorder. It is when the upper chambers of the heart, the atria, just like the chamber in a hotel or a room that gathers people, the atrium on the top chambers gather the blood before they are brought to the pumping chambers. The atrium fibrillate, they beat very, very fast. So atrial fibrillation is a rapid, irregular heart rhythm disorder, and it's very common.
Why is it so common, do you believe?
It's very common predominantly in the elderly population. As people get older, it becomes more common. About 5% of people over age 65 develop atrial fibrillation, and why it's more common is probably because as people get older, there's changes that occur in the atrium. A lot of people have hypertension or other heart conditions that can lead to scarring or dilatation of the upper chambers of the heart that can lead to atrial fibrillation.
Okay. So it's actually, you're not born with it, or are you born with it?
No, it's actually very rare for young people to have atrial fibrillation, and it's probably because the atrium, the chambers of the heart are very small in children. As people get older, the atria get big, and there's enough muscle mass, or substrate, as we say, to allow atrial fibrillation to occur.
Okay. Now, what's the preponderance of it being with women, adults, children? You did mention already, seniors, but how about the other
as people, it's very rare in children, but as people get older, it definitely becomes more common. But we see patients in their 20s and 30s with atrial fibrillation, and in young patients like that, it's usually primarily an electrical disorder. In patients who are older, it's often associated with other underlying cardiac conditions. So the cardiac conditions that can lead to atrial fibrillation are congestive heart failure, coronary disease, valvular heart disease, cardiomyopathies. Some of these heart muscle disorders can lead to heart rhythm disorders.
Geez, it says here, now you've put together a support team, addresses issues including understanding the various aspects of the disease. Okay. Questions to ask a healthcare professional during appointment. First of all, how do you know whether you have it?
That's a great question. The only way to really make a diagnosis is to record your heart rhythm, typically with an electrocardiogram. But there's a very wide spectrum of symptoms. There's patients who show up to their doctor's office and are found to be in atrial fibrillation when the doctor examines them and then confirms it with an electrocardiogram, who have no symptoms. So there's patients walking around with atrial fibrillation who are unaware of it. To the other extreme of patients who, as soon as they go into it, their heart rate's very fast, they're very symptomatic from it, and end up having to go to the emergency room or be admitted to the hospital with it. But typically the symptoms are a rapid, irregular pulse that can lead to shortness of breath, chest pain, dizziness, and another important complication or consequence of atrial fibrillation is a stroke. Because the upper chambers of the heart aren't pumping normally, and a clot can form, which, if it leaves the heart and goes to the brain, can result in a stroke.
Wow. So do people have to prepare their lives differently to deal with this concern?
Yeah, it can have a big impact on people's quality of life, and that's really the main mission when we treat patients with atrial fibrillation. It's not, in general, a life-threatening disorder. It's more of a interruptive or disruptive problem, so it can really interfere with people's quality of life, and people can, I think, learn to live with it in many ways. One goal is to try to improve the frequency and the symptoms with medications and other things. But in terms of lifestyle modifications, there are a lot of other things that people can do. We've tried to make these points to patients when we see them in clinic, and with this AFib support team, that there's a lot of other healthcare professionals that can help. There's exercise physiologists, there's nursing support, and there's a whole group of people that can help. An example of a way you can adjust your lifestyle is that when you're traveling, be certain you bring your medications with you. Don't pack them, carry them on the airplane. Make sure that when you're going to a new destination that you know of a hospital nearby, or perhaps ask your physician if they know anybody that if you were to have AFib while you're there, that you can seek out some medical attention while you're at that new place.
There's an article here in Science Times in the New York Times this week for heart rhythms that do not respond to drugs should instead be treated with a procedure, that catheterizes the muscle around the vein that carries blood from the lungs to the heart. Okay, what's the thought on that?
Yeah, this is a procedure called catheter ablation, and it's been being performed for atrial fibrillation for about 10 years now, and I'm actively involved in performing that procedure and seeing patients to determine their eligibility. People who have atrial fibrillation that continue to be symptomatic despite medicines are good candidates for an ablation procedure. And what that means is we go up into the heart through the veins in the leg, and we cross over into the left side of the heart where the veins that drain the lungs, the pulmonary veins, enter the heart. And that area seems to be a very important place for the triggers and maintenance of atrial fibrillation. And the procedure involves delivering radio frequency waves in most instances to cauterize the tissue around the pulmonary veins. So point by point we make sequential ablation lesions to kind of isolate the pulmonary veins from the left atrium. And when we can eliminate atrial fibrillation in patients that are symptomatic despite medicines, it can have a real big improvement in their quality of life.
How about eating? Is this at all based around that, say, we eat too much fat, or we eat trans fat, saturated fat, whatever it is?
Yeah, that's a good point. Dietary modifications are very important in general to prevent coronary artery disease. How it impacts atrial fibrillation is a little bit different. Obesity is a big risk factor. So, in terms of diet, the obesity epidemic is probably one of the reasons why there's been a large increase in the numbers of patients with atrial fibrillation. So keeping your weight down can help prevent atrial fibrillation.
I'm sorry, go on.
No, I was just going to mention that some people will also identify a trigger. So if alcohol or chocolate or caffeine triggers their atrial fibrillation, it's important to modify your diet to avoid those things.
If you live a less stressed life, okay, and you're doing yoga 24/7, and calming yoga, relaxing or whatever, do you think that could have any bearing in bringing in more air oxidation through deep breathing? That could be helpful?
I think interventions to prevent stress or to minimize stress are important. It can lead to a lower incidence of heart attacks, possibly. Atrial fibrillation is kind of the tip of the iceberg, so anything we can do to prevent, heart disease, a heart attack, those things will ultimately, I think, reduce atrial fibrillation. And there's patients that, again, not everybody, but if you are a patient who has recurrent atrial fibrillation and you've identified that stressful situations provoke an episode, which is not uncommon, then doing these types of things you're mentioning to reduce stress would be important.
Okay, I just want to read this again, and I think it's then what you're saying, it's extremely important to get that EKG, right?
Yes.
For everybody to get it. When you first of all, to have an annual checkup, no matter what, right?
Most of the time, if a physician examines you and you're in atrial fibrillation, it will be picked up. The way to confirm that that is the rhythm that you're having is to have an electrocardiogram. So I don't think everybody needs an EKG, but everybody should be regularly seeing their doctor. And if you have any symptoms that would suggest your heart rhythm is not normal, your pulse is irregular, you're short of breath, you have any new cardiac symptoms, then by all means you need to be examined.
Okay, and then you guys have a website as well here.
Yeah, the website is the AFibSupportTeam.com. It's A, F as in Frank, I, B as in boy, AFibSupportTeam.com. And it is really a useful resource site that includes information from physicians, nurses, exercise physiologists, fitness experts, and lifestyle gerontologists that provides useful information. The time that we have with patients and doctors is increasingly limited, so I think it's a useful supplement to a doctor's appointment that can provide a little bit more information about atrial fibrillation and the potential treatment.
And you can also see Dr. Knight. See what he really looks like, not just that voice, the face behind the voice. Last question. What's good news for you, Dr. Knight?
Good news for me is that there's some new hope for people with atrial fibrillation. We talked about catheter ablation, which has been around for about 10 years, but there are new medications that have become available. There's new experience with surgical procedures to treat atrial fibrillation. 20, 30 years ago, there were really very few options for patients with atrial fibrillation, and it was, people were just kind of told to live with it and, limit their expectations. And I think the good news for me is that there's new treatment options for these patients.
And we say here, just to throw that out, I don't know if that number came up in our conversation, but 3.1 million Americans are diagnosed with it.
Yes, very common. It's becoming more common. One reason probably is people are becoming more obese, but another likely reason is that patients are living longer, and as patients live longer, atrial fibrillation can pop up.
One last, I'm sorry, if you don't mind.
No.
Why do you think it's popular? All right, 13% of the Americans over the age of 70 are living with the condition. Why do you think it's popping up so now 60s and 70-year-olds?
Well, it's always been common in patients as they get older, but I think more people are getting older, more people are living longer, and it's just increasing the pool of patients. Some recent data showed that about 2.5 million Americans have atrial fibrillation, and more recently 3.1 million Americans. So in a way, it's an epidemic. It's a very common heart rhythm disorder, and I suspect that many of your listeners have friends or family who have experienced this irregular rhythm.
All right, get out there and exercise.
That's right.
All right, Dr. Knight, thank you very much for sharing good news with us.
Paul, thank you very much.
Take care. Bye-bye.
Bye-bye.